Good afternoon, everyone. I'm Brooke Duncan, the Director of Community Development at Uptown Consortium. I'll be leading the technology during today's session. Please use the chat function to ask any questions that you may have, and feel free to use the chat to message me if you have any technical issues. We're really excited to welcome everyone, and I'm pleased to introduce Beth Robinson, the President and CEO of Uptown Consortium. She will be leading today's session. Take it away.
Thank you, Brooke, and good afternoon, everyone, and welcome to Uptown Insights. This is our virtual series that we produce to inform and engage our community. And so we're very happy to have you all tuning in today. For our discussion, we have invited leaders from UC Health to share really important information about the COVID-19 vaccine rollout and answer questions that you may have about it. I know we're all anxious to get life back to normal and anxious to learn about the vaccine. And we have had many questions that were submitted during registration, and we will try to get to as many of those as we have time for. And as Brooke mentioned, if you have any questions during the program, just go ahead and put those in the chat box, and we will try to get to those too as time allows. And then later in the program, Councilmember Jan-Michele Kearney will be joining us to partake in the discussion. So now I'd like to introduce our experts from UC Health. First, we have Dr. Rick Lofgren joining us. And as many of you know, Dr. Lofgren is President and CEO of UC Health, the region's academic healthcare system. And we're so fortunate to have him and UC Health here in our community. Dr. Lofgren is also an advisor to Governor DeWine on the state's response to the pandemic. And Dr. Lofgren is also a member of the Uptown Consortium Board of Directors. So welcome, Dr. Lofgren.
Thank you.
Also joining us today is Dr. Jennifer Forrester. Dr. Forrester is an associate professor of medicine at the College of Medicine at UC and the associate chief medical officer. She is the university's Women in Medicine and Science co-president and one of only 2 female associates. So we're very happy to have Dr. Forrester with us. She's leading the response from UC Health. So welcome, Dr. Forrester. So what we're going to do today is Dr. Lofgren and Dr. Forrester will be doing a presentation. And once that's over, then we'll go into the questions. So with that, I'm going to turn it over to our experts.
Thank you, Beth. And I'm going to take a moment to try to share my screen. Everybody hold their breath. And I really want to take a moment to thank everybody, to thank Uptown and Beth for inviting us today. We're really excited to talk about the rollout, if you will. So again, I'm Rick Lofgren, CEO of UC Health, and joining me today is Dr. Forrester, who is an expert, an infectious disease doctor and an expert, and is make sure that I say everything correctly. So I appreciate her participating as well. Just as Beth mentioned about UC Health, just a moment to remind ourselves and everybody of our the fact that we're thrilled to be part of the Uptown and Uptown community. And our purpose is really quite simple. It's to advance healing and reduce suffering in our community and really bringing the academic medicine difference. And one of those things is really bringing the highest level of medical care by really providing unique service and life-altering therapies and specialty therapies to our community. For example, in the COVID pandemic, one of the things that we've really been able to do is use our expertise on ECMO therapy, which is a bypass machine that helps heart and lungs when they fail. It really has made it literally life-saving in some cases. We're also the source of education as well as groundbreaking research. And we can talk a little bit about that importance as we talk about some of the clinical trials that's related to COVID. So I appreciate it, everybody. So we thought we'd take a little bit talking about the vaccine development, how it works and how it was developed so quickly. I know that's a concern that people have in terms like, well, did they skip steps along the way? Is the science solid? And I'm here to tell you that they went through the the rigor of the science, and we'll spend a moment talking a little bit about it. I find it personally very fascinating and intriguing about how this new vaccine technology called mRNA works. Talk about the safety elements, because that's really what people are concerned about. Does it work? Is it safe? Talk about how we're rolling it out, and then we can turn it over to some frequently asked questions and get into a Q&A session in and of itself. So one of the things I think is very important to always remember is that we already knew and know a lot about how we can stop the spread of this virus that's very effective, that doesn't take a vaccine. That's social distancing, keeping distance, the use of face mask, reduces the transmission by 85% and eye protection by 75%. I think one of the things that I learned in the last year as I've watched this pandemic roll out is I knew face masks work, but if anything, they work much more effectively than I originally thought they would. So it's a very important part of our armamentarium to slow the spread of this virus in our community. What's depicted here is sort of the normal course of the development of a new drug or vaccine. It goes through some very specific stages of looking sort of, do we have an idea? Then a phase 1 trial, is it at all safe? A phase 2 trial, does it seem to work? And a phase 3 trial is enough people that we really can be confident that it works. Then it gets approved, and then the manufacturer starts to produce it. And depending on the development, that can take anywhere from 5 to 15 years. And yet we've been able to shorten that, mainly because we did a lot of development in parallel. We didn't wait with the next stage. We went right to the phases, as you can see, sort of stacked up here. In fact, one of the things you might notice is that the manufacturers of these vaccines started to produce large quantities of vaccines before they even had the results from the final trials that they were confident that it worked. So when they did get the evidence and they were fairly certain it would work, but they didn't have the science at that point, they were still producing it. And that really allowed us to foreshorten the production. So there are over 150 vaccines that are in development. There are, I think actually more than 61 in clinical trials at this point. And there are 4 different platforms, how they work. And I won't go into great details, but the newest one is this mRNA, which is really what Pfizer and Moderna, or the first 2 vaccines, are the vectors they use. There's these other ones, viral vector, which I think J&J uses, and we see some other ones that I think the recombinant protein is what Novavax are using, but there's different ways in which they work. But the 2 that are approved are both in this mRNA platform. I was telling others, this is where I get really excited about the science, and I will go in advance to tell you this is where I geek out a little bit. So you'll have to indulge me a little bit, because I think the science here is really fascinating. So the way that the body works is that your DNA sends a message within the cell to produce a protein. And the way it does that is that it pieces a little piece of messenger DNA called messenger RNA. So a message from your DNA goes to the apparatus that produces a protein called messenger RNA. And what they've done is that they've identified the sequence to send a message to produce a certain protein that's common on the coronavirus, or COVID-19, and they introduce it to the cell. And the cell then produces this protein on their surface. But unlike when it's infected, it doesn't change the DNA or it doesn't destroy the cell. And in fact, the mRNA, after it sends the message, actually disappears shortly. But what it does do is that your normal cell then will start to produce this protein, and your body assumes that it's a foreign substance and produces the antibodies and the immunity itself. One of the things that's probably important to know is that this technology, this unique way of sending just the message to the cell without affecting the DNA, has been in development for well over 10 years. And because the science was already there, it was able to pivot quickly into a new application and producing a vaccine that's been highly effective and really in a very short order. But it's really important to understand that you're not introducing the virus, you're not altering the DNA, and the particles that are introduced with the vaccine disappear in a relatively short period of time. And so the Pfizer 3, which is the first one that got out there, that was introduced, they enrolled over 43,000 participants. And after the 7 days after the second dose, it was more than 95% effective in preventing infections from the COVID-19. 170 cases were detected, 162 in the control group. And of the 10 cases that had severe, only one of them was in the cases of the patients who've been vaccinated. It was consistent across all ages, gender, race, and ethnicity. You know, a vaccine would be considered highly effective if you see something at 70%. So something that comes out at 95% was really a very pleasant surprise about how effective it has been. The Moderna one is also then had its preliminary report, 30,000 individuals. The vaccine was very well tolerated. What adverse effects were mild and not severe. And really, again, the same sort of thing where it was highly effective in preventing infection. And in fact, they had no cases of severe disease of the small number of patients that did, in fact, become infected, suggesting that there was at least partial immunity, preventing it from becoming a more significant disease. And what you see depicted here in the picture is one of our trial at UC Health, and our first individual, Gerald Marshall, who was the first person to volunteer to be part of the vaccination trial. And he's getting some follow-up blood work to make sure that we understand how the immunity and how long it's lasting. And this is just some of the publicity that our participation in the clinical trial. We were one of 80 sites around the United States. I think the other thing that our team was really exceptional is that it was led really the nation in ability to recruit minority participants. One of the problems we often have in clinical trials is that the people who participate in the trials are really relatively similar, both of age and gender and frankly, race. So it's very important that we had a real widespread of people participating, particularly participants from minority communities. And in fact, we did so well in terms of leading it that the people from Operation Warp Speed came to us to congratulate us on what a great job we were doing to make sure that we had representation in the community, and so that we could say with confidence that this vaccine is effective and is effective across all age groups, all genders, all races, which is important to recognize. So that gets onto the safety element of this. And, you know, the common side effects of the mRNAs is they're usually very well tolerated. You may experience some mild to moderate side effects. The most common side effects are pain at the injection site, maybe a little redness, fatigue and headache, muscle aches. I actually, not all that long ago, got my first dose, and my arm was achy, but really tolerated it well. People will tend to have more side effects after the second dose. And a small percentage will actually have a fever and feel a little sluggish. And in so many ways, what that really tells you is that the immunity is working. It doesn't mean you have COVID. It means that your body is responding to the signal that you might be infected, which tells you that it's actually working. But typically when people have side effects, maybe 10% of people will feel really enough so that it interferes with their daily lives. It really is fairly short-lived, less than 24 hours. So that gets into the common concerns, you know, did we produce this vaccine so quickly? Do we really know it's safe? And I think there are a couple important points at this to mention at this point in time. One is that with the vaccine, our experience is that if we're going to see complications or side effects, it tends to be pretty quickly after the dose administration. There's not several weeks or months actually that lapses, and then you start to see a side effect. The other thing that you need to understand at this point in time, we have millions of people who have received this vaccine and have been receiving this for at least 9 months now. And we have not seen or detected any significant or serious side effects. The only thing you might have read about is that a very small percentage of people will have an allergic reaction, which is probably less from the vaccine and more about some of the chemicals that are part of the way in which it's produced. So again, is there sufficient time to know side effects? By and large, you know, absolutely. Again, most side effects that are significant show up pretty quickly after a vaccine. And again, we have, at this point in time, millions of people who have received this vaccine, and the safety continues to be very impressive and well. We want to recognize there's historical concerns about research and trust. This is particularly true, I think, in minority communities, and unfortunately from historical reasons, for some good reasons. This is why we thought it's very important that we ensure that this research was conducted with the lens wide open, that we are trying to recruit minority and people from all different walks of our community to participate, so that we can talk about that this vaccine has been developed. We understand how it works in different individuals and is safe and effective. And then obviously there is some ongoing concerns about vaccines and public safety. And again, that's just something that we need to continue to message. These vaccines are very effective. This is going to be the way in which we are going to get back our lives, that we're going to get this virus under control. And I think we're all, particularly people at the highest risk for complications, I know are very excited about the opportunity to get vaccinated. I don't think we included it, but one of the very first people we vaccinated, I think they were in their 90s, who drove into our drive-in, the records, and besides being beyond adorable, their whole thing is that they wanted to get back and go square dancing again. And it really is exciting and rewarding as they start to roll out the vaccines. So I thought I'd touch upon some of the issues around the rollout and to understand where we are. I think one of the things I will tell you is that our ability to deliver vaccines in multiple sites exceeds the amount of doses we have available. So at this point in time, we really understand that people particularly at risk, older individuals in particular, are very interested in getting the vaccine, and everybody involved is working hard to try to get the distribution out as quickly and as equitably as possible. So I thought I'd share a little bit where we stand. I looked at the data from yesterday. So this is 24 hours old. So hopefully it's changed since this time. But in the first phase, which was really started in the middle part of December, was really 1A. In fact, UC Health was the first place in the state to actually receive its vaccine and started in the middle part of December. It was really designed to make sure that we were protecting the healthcare workers so that they were available to take care of individuals as the pandemic occurred. And certainly as we looked in November and December, we were overwhelmed as a community with the number of people in our hospital infected with COVID. First responders is the same thing. And what we did in Ohio, participated in a program pretty aggressively of going out and vaccinating all the residents in nursing homes, as well as the staff that works there. The nursing home program was actually led by the private pharmacies, particularly Walgreens and CVS, who led the charge. And I can tell you, several months later, we're already seeing a dramatic reduction in the number of infections at nursing homes. Really as much as 60–80% reduction. And I think that's translating to seeing less patients coming into our hospital. The phase B started in the latter part of January. And this is where the state really decided how is it going to phase in the deployment. And they started by age brackets. A lot of conversations about who's at the highest risk, how you define different workers. I think the dialogue, I can tell you, to define essential workers. Well, at some point, all workers are essential. So that was not really all that differentiating. And one of the things also is that age is still one of the biggest predictors of the outcome. If you compare the likelihood of dying from COVID from a 30-year-old to somebody over 80, an 80-year-old has 680 times more likely to die. So this idea about rolling it out by age groups really follows the science. And so there's a sequence of 80s to 75-year-olds to 70-year-olds to the point where we are right now of greater than 65. The challenge of being, of course, is that we have more people over the age of 65 than we have vaccine. And so we continue to roll it out. The other groups that have been identified by the governor was really recognizing the really negative impact that being out of school has for many of our children in different communities. And so they really intentionally went out and identified vaccines for teachers from K to 12th grade, really the idea of getting them back into the classroom in March. So that was a very, and no more recently, some select people with developmental disabilities and chronic diseases, but it's still pretty much age-based. So where are we as a state? So the state now has done over 1.4 million doses of at least the first dose of the vaccine, or about 12.6% of Ohioans have received their first dose. The distribution, however, is not equitable across race. It's 11.8% in whites and only 5.2% in African Americans. One of the limitations of our data, though, is we still have a large percentage of people not reporting their race, about 15%, both statewide and actually even here in the Hamilton County. Hamilton County has done somewhat better than the state. We've vaccinated almost 110,000 individuals, or over 13%, 13.4%. We still see, however, the discrepancy between African Americans and white populations, again, with 15,000 people unknown in terms of their ethnicity, race and ethnicity. At UC Health, I've included what we've done here. We identified our frontline workers and the like. We vaccinated about 9,000 of our associates. I'm here pleased to report that 99.3% of them have received their second dose. What we've done in the community is that we've vaccinated 13,375, and about 51% of them have already received their second dose. So our deployment has actually gone really well. And for those in the Uptown, recognize that we decided to actually do a drive-through using the basement of the UCG&I, so that people didn't have to find where to park, simply could drive into their car, register, get an educational video, get vaccinated, go up to the next floor and wait 15 minutes to be observed to make sure there wasn't any complications and move out. So it's been very effective for us. But getting back to the equity issues, this is where all the healthcare providers have come together, the public health, to really develop a very deliberate and intentional program to improve the equitability of the vaccine distribution. So working with United Way has developed a 211 hotline to help with scheduling. The Council on Aging is has an ability to provide free transport for seniors. More recently, there's been a plan that they've gone out to low-income senior housing using the National Guard in support with the county and health, both the city and county health departments. I believe last week we had the first 3 sites that we had the National Guard and low-income housing. It went extremely well. In fact, I think they busted in a few other people to get the vaccine. Very effective. In addition, we're identifying clinics where in high-need neighborhoods. The county health department is setting up areas of high need. The city health department is partnering with their community leaders in Price Hill, Santa Maria. The First Ladies, which includes a program at the New Prospect Baptist Church, and the Urban League in Closing the Health Gap. In addition, we're working closely with the FQHCs and making sure that they're getting additional doses because of the communities they serve, all in an effort to really try to address the issues about the racial disparities. And there's a number of things that are being proposed. I'll just highlight them, is really making sure that we set aside more vaccines to these high-risk communities. We've made an intention that at least 20% of the vaccines coming to Hamilton County will be targeted to high-need areas, putting together in the future strike force where people within the who live in that neighborhood will be invited specifically. Again, continuing that what we're working with low-income seniors. In Avondale here, both Oak Street as well as the City Health Department, the Ambrose Clemens Center has vaccines available as well, and continuing to work with the National Guard for low-income housing. We have some strategies. One of the things that I know you're going to talk about is the difficulty of scheduling. It is problematic. We've put together a single website where all the different websites are located, but you really do need to go from every facility, a provider, to try to find an appointment. And it's really a problem for people who struggle with the internet or have language problems. Trying to use United Way's 211 to help with that. You know, there's issues about physical access. There is free transportation, again, from the Council on Aging, but it does require a couple days notice. Again, noted here is that we actually at UC Health have a drive-through, which really did help with the mobility of our older adults. And more recently, trying to figure out what we do with homebound. And still, we need to deal with vaccine hesitancy. And so making sure that accurate information about the vaccine rolls out, particularly to our minority communities, and making sure the message is coming from trusted partners and trusted leaders, and frankly, making sure it includes various languages. And there continues to be concerns by about people who are concerned about their immigration status as well. And then finally, what I just commented from the UC Health side, we have 20% that is for our general community. You don't have to be an Ohio resident. You don't have to be a UC Health patient. If you are one of our patients, we tell you to please ask you to go to my chart. If you're not one of our patients, then simply call 584-DOSE or visit our website. But I've also included here some really, I think, other important resources. Everybody's come together through the Health Collaborative and put up a website called testandprotectcincinnati.com. Has the latest information on all the sites that are doing testing, as well as the vaccination sites. When you click onto the various sites and providers, as well as some really good educational material. And then our own Closing the Health Gap has put up a website that is actually a real resource and provides a lot of good information from a variety of community leaders that I think will help us as we move forward. So with that, I'm going to turn it over to my colleague, Dr. Forrester, and jump into some of the frequently asked questions before we get to some of the general questions. Dr. Forrester.
Great. So we wanted to start with some questions that we get a lot, that can often be, or you hear here and there, and can often cause some confusion. So the first is what is herd immunity and why do we even care? So you can see on the figure on the left, you can see what it's like when no one is immune. So when a novel or new infection like COVID, we'd never seen it before, it can jump from person to person because everyone's susceptible. Like I said, our bodies hadn't seen it before. It didn't know how to react to it. But then when you move to the image on the right, as people start to gain immunity, either after they recover from the disease or after they get a vaccine, the path of viral transmission is basically stopped or is minimalized, as in the one person who gets infected there. And this is important for a lot of reasons. First, certainly we want to save lives, and the less people infected, the less chance of serious consequences in those people. Also, though, when the virus goes from person to person, it makes copies of itself, and because it's a virus, it makes a lot of mistakes, and this is where variants arise. And sometimes those can be more infectious or more dangerous than the initial strain. So the quicker we get people vaccinated, then we can stop the variants in their tracks. And really, the third point is that herd immunity is really our way out of this pandemic. It's the way back to normal, as Dr. Lofgren had said. Next slide. So when will I get my vaccine? Well, right now it is certainly, the state only gets about 100,000 vaccines each week from the federal government, and then those are divvied out kind of by some fancy math above where the population is in the state. Besides there being a significant amount of people in the US and also in the state of Ohio, it's going to take some time to deliver the right amount of vaccine to where these people are. And each state really had to make and execute its own plan. We have noted that the Pfizer and Moderna vaccines really do require refrigeration or even some super cold freezers, which is a challenge in getting the vaccine to maybe the outlying areas in certain communities. We had to develop a plan to vaccinate in order of priority, and we did that by who was at the greatest risk of death and who was at the greatest risk of serious complications. And right now, unfortunately, there's just not enough. I say there's more arms than needles. As soon as we get more needles or more vaccine, we are already prepared to start vaccinating people. The more that we're ready for it, basically. And what about vaccinating children? So in terms of children and the infection, although we have seen a number of infections, there really have not been that many deaths, but for sure one is one too many. Also, vaccination of children will likely be needed to reach that herd immunity that I talked about. Like, they are certainly, in fact, part of our community. The studies are ongoing with children right now. So I'm sure as some of that data comes out, we'll learn more and more about that as an important goal in reaching our back to normal status. Next slide. So what about if you've already had COVID? Do you need to get the vaccine? So natural immunity or the immune response that a person gets after they recover from a disease is often less robust than the immunity that is conferred by a vaccine. And it also may be shorter lived. So maybe only 3 months versus 9+ months, a year, et cetera, or even longer. Therefore, we do recommend, the CDC recommends that once someone has recovered from COVID, that they still get the vaccine. We believe that the antibodies that people have once they have contracted the disease last at least 90 days. And so they can likely wait that amount of time and still be mostly immune in that amount of time. But to continue their immunity, the vaccine will help after that. And okay. And then what about the new,
something else?
I was going to say about this is actually I looked at some data recently that recurrent infection is exquisitely low in that 90-day period. And actually, even we've only seen this disease obviously for a year, and there's been a limited number of reinfections, which is good news. Now there can be some reporting issues, but I do think that that's good news that as we get people immune, that we're not seeing recurrent infections, which is awesome. All right, and then the new strains, will the vaccines work? So this goes into a little bit about what the vaccines do. So the vaccines that we currently have, the mRNA vaccines, they help our bodies make antibodies or infection fighting molecules that recognize spike proteins, which is, they create this crown-like appearance on the coronavirus, which is why it's called coronavirus. And so the variants that we're seeing, the UK variant, the South African variant, for example, do have mutations or changes in the spike proteins, as well as other mutations. So the logical question is, what do those variations mean for the efficacy of our vaccines? And the good news through some of the studies that are coming out is that the vaccines still do protect us against those variants that we know now. Though some may be mildly less effective than against the original strains. So we're kind of in a race between the variants and the vaccine. So until we reach that herd immunity status, it's still really important to do all those things that we know stop the spread of the virus, which is wearing masks, social distancing, hand washing, staying away from others when you're sick, and that type of thing. Because if, like I said before, if the virus can't move from person to person, then it can't actually spread a variant or a mutation. And then our vaccines will continue to be effective, which is our goal. All right, and so we're hoping that you have learned a good amount. It's fun to get this information out, and we're with our shared goal of kind of protecting our community. The COVID-19 vaccines were tested rigorously in trials. They are safe and effective. As Dr. Lofgren aptly said, the vaccine is new, but the science isn't. I've heard the cake was baked. We knew the science of vaccines, and this is the flavor of the icing on top. It's really just a little tweak to see how we get it into people effectively, which we did. Honestly, this vaccine hit it out of the park. These two vaccines hit it out of the park. There are some side effects, and those typically go away in the first day after receiving the vaccine, but that's actually a normal sign that your body is building protection. If you don't have those types of reactions, it does not mean the opposite. It's just your body has a different way of building its protection, or is used to a different, or shows it in a different way. The COVID-19 vaccine will not make you sick with COVID-19. It does not contain a live virus. And certainly at this point, every eligible American should be able to get the vaccine. Cost is not an obstacle. And that's very important, a way to make sure that we don't at least have that barrier. We know we have other barriers, but we don't have that barrier. And it's just one of the many tools that we need to do to stop this pandemic. So we still need to continue, I feel like a broken record, doing all those things that we know stop the virus, the mask, the hand washing, the social distancing, really until we're far ahead of this.
And with that, I'll stop sharing. Maybe turn it back over to you, Beth.
Okay, well, thank you, Dr. Forrester and Dr. Lofgren. It was so much good information. And I think we're all hungry for the latest information. And so you provided us really with a lot. And we will be sharing some of this with those who are tuning in because there's a lot to digest. Quick question for you. So the vaccine's free? Is that everyone, and there's no cost to it, right?
The one thing you will see is that that the vaccine was purchased by the government and distributed, and the vaccine itself is free. There can be a small administration charge that various places do charge. I know that the health departments do not. I don't know. So there can be a small, I think it's like $15 or $20 administration charge with it, but the vaccine itself is free and available to everybody. And the county health departments and other facilities have actually made sure that their sites actually don't charge anything, including the administration fees.
Yeah, that's very important. And I'd like to stop here and welcome Council Member Jan-Michele Kearney. Welcome. You're on mute, I believe. Maybe Brooke can unmute you. There you are.
Oh, how are you? Thanks for having me.
Very good. Well, thank you for joining us. I know it's a busy day. You have, I believe it's City Council today.
We just finished. All is well. I'm not in a hurry. Everything is great. Timing worked out perfectly. I really enjoyed this presentation from Dr. Lofgren and Dr. Forrester. So thank you for that.
Well, thank you.
Good information.
It is. It's great information. And so, Councilmember Kearney, we'd like to maybe hear from your perspective and from, I know the health department, the city's health department, and the city has been very active in this space and getting information out, but maybe just from your perspective, what you're concerned about and what you may be working on.
Okay, thank you so much. First, Beth, I really want to thank you and the Uptown Consortium for organizing this panel, Dr. Richard Lofgren and UC Health for all that invaluable information that you shared, Dr. Jennifer Forrester. You're doing so much to actually save lives, and this pandemic is just crazy, and you're getting us through it. And that herd immunity, that chart looks so good. I can't wait until we're there, and we are on the way. So that is great, and it's good news. So getting vaccine news to the community has been a really huge priority because there is so much misinformation, so much fear, and so much mistrust, just distrust. Of course, and I never want to discount the way that the African-American community has been mistreated by some segments of the healthcare community in the past and present. The Tuskegee syphilis experiment, for example, lasted 40 years, from the 1930s to the 1970s. I mean, it's infamous. And for anybody 50 years or older, it happened in our lifetime. For the rest of you, it happened in the lifetime of your parents or grandparents. It wasn't that long ago. And, we all remember it, remember hearing about it. And so, that's just one of the things that really makes the African-American community mistrustful of, people say, hey, take this vaccine, it's something new. You also hear studies about, Black people not getting the same treatment for pain, for example, because, we supposedly have a higher threshold for pain. I mean, there's so many inequities that, the trust factor is really difficult. So the distrust is ongoing, it's understandable, and yet, as Dr. Lofgren pointed out, we are dying from COVID at a higher rate than other populations. So the need to build trust is really immediate, it's urgent, and it's really hard. You know, one of the things you're doing today that really helps a lot is separating fact from fiction. You know, and that's just a major step, because when people start talking about, you know, how do they get information, you know, they get it everywhere. You know, the social media, internet, there's so many misconceptions out there. So, you know, we really need physicians, especially Black physicians and healthcare workers, to let us know that these vaccines are safe. So, you know, having said that, I have to give a lot of credit. There are two UC Health physicians that I interact with a lot, and they are just phenomenal, Dr. Lou Edgy and Dr. Michael Thomas. They both are participants in the clinical trial. I mean, they signed up before knowing that the vaccines were even safe or effective. And I think that's a huge sacrifice that they made for us, the community of Cincinnati. And it's because of their firsthand knowledge and their experience that, you know, we can really be reassured that taking the vaccine is absolutely safe, and ultimately it's really life-saving. You know, both Dr. Edgy, I talked to Dr. Edgy on a town hall meeting that the Center for Closing the Health Gap does on Saturdays at 4, and she's on a lot, and Dr. Thomas has been on from time to time as well. They're just ready at a moment's notice to jump on a Zoom call, get interviewed, speak to the media about the need to take the vaccine and really to dispel the myths that are out there. So I really, I just want to thank them, just take this opportunity to thank them and the UC Health family, because dispelling the myths is so important. People need the real facts. They need the real information in order to overcome the kind of, you know, distrust that's out there, you know, as I said, which is understandable. And I like the way, it might have been Dr. Forrester who mentioned about the cake being baked. That's an example that Dr. Edgy uses a lot. She says, you know, we've been baking that, like, this vaccine isn't new. I mean, this virus isn't new. We've been baking this cake, she says, for like 20 years, you know, and now we're just like, the vaccine is kind of like, you know, the cherry on top of the cake, you know, or the icing on the cake. But these trials have, you know, have gone on. The work on the vaccine has gone on. It's, you know, even though it was called Operation Warp Speed, which, you know, might have been, and maybe an unfortunate name, I don't know, but it's really been a long time in coming. And she also points out that, you know, one of the individuals who at the forefront of development of the vaccine is a Black physician, Dr. Kizzy Corbett. And I had never heard of her before Dr. Edgy talked about her. And suddenly she's, you know, in the news everywhere. And so I think that's really important too. So back to the Center for Closing the Health Gaps town hall meeting, which by the way is Saturdays at 4. But you know, we've had a lot of guests, and you know, amazingly, or maybe it's not so amazing, a lot of them are really young, and they're saying how they're totally against getting vaccinated. They're just against it. They've heard like all these myths, and you know, we can talk about, you know, some of the myths that are out there. But after they hear the facts from trusted, credible, known sources, and I heard Dr. Lofgren say it's so important to get information from trusted sources. But then they, at the end of that, they say, okay, I'm going to rethink this. I'm kind of opening my mind to getting vaccinated after all, whereas before they came in and they were totally against it. So, you know, the best way to sort fact from fiction is just by taking a hard look at the source. You know, here we have Black physicians that aren't just telling us to get vaccinated, but, you know, like Dr. Edgy and Dr. Thomas, they themselves have participated in clinical trials, and they're still in these trials. And so, you know, I think that is so important. And when you ask me, you know, what am I really pushing for and looking at, it's really what you're doing here today, separating fact from fiction, getting the information out to the community so that people can make good decisions. And a good decision is one that saves your life, saves the life of a loved one. And the way to do that is to get vaccinated. No one has died from any vaccine, from any, you know, any COVID vaccine. I mean, but what, 500,000 people in the US have died from COVID. And so, you know, we've got to get vaccinated, really, really important. So I just thank you for separating fact from fiction and for getting this information out there and for all the work that UC Health is doing. Really, really important.
And thanks to you, council member, you are an important stakeholder, an important figure. Obviously in Uptown, you went to Rockdale Elementary. In
Yes.
Rockdale, yes. And you're an important figure in the community. So having your voice and leading with your voice is really important to this effort as well. And something you said that strikes me is that there's an urgency here. We don't have time to do maybe a more traditional get out the word kind of effort. And I know it's all hands on deck. You've got all these partners, but maybe this is to Dr. Lofgren. What I'm sure a lot of thought and a lot of your team's attention goes to just what Council Member Kearney's talking about, getting that information out to those hard to reach and skeptical populations. And maybe you want to speak to that.
Yeah, two things that it reminds me of. One is that throughout the early part of the pandemic, we recognized that people get different information from different sources and trusted sources alike. So one message, one source was not going to be adequate. This is where I actually think the Health Collaborative, working with the Chamber, actually engaged Regina to think about really how can we get the messaging out in multiple ways and in multiple venues, and put together what's called the RC3, which is really an effort to have a concerted way of thinking about different messages throughout the pandemic. I also think that is Councilman Kearney mentioned, is that different voices as well. And one of the ones that I think has really been a couple of consistent voices also out there really speaking to a variety of communities is Closing the Health Gap. Their website is really wonderful with all sorts of resources and video clips and the like. If you haven't been out there, that speaks to different groups of individuals and age, not only sort of race and gender, but age as well, as really makes a difference. And I know Interact for Health has been out there. I know Dr. Adele Owens has been at the forefront of really sort of educating as well. The other thing that I would say, this issue about the education, and this is as I think about the rollout, as Dr. Forrester said, right now we have more arms than needles. And really this first phase is what we're trying to do is vaccinate all the people who are at the highest risk of really getting serious complications and dying. The second phase is that whole herd immunity. And we're going to have to message to people who are relatively young, relatively healthy, who are very healthy or whoever, not nearly as big a risk, but to get that picture where Dr. Forrester said, listen, everybody's immune so that we're not getting variants and we're not getting the virus, and we can go back to mass gatherings. Oh my God, a concert, but that's going to come only when we get to the second messaging as well, that we're going to need to protect the community to get our life back. And that means that all the people in the community need to participate. We need to make it available to everybody, and we need to get the messaging out to everybody, and we need to make sure that they participate so that we get to that second phase of herd immunity, which means we're putting this, god awful year behind us. And, I keep waiting for the day when my life gets back into 3D.
We all are anxious for that day. Yeah, and that leads me to my next question, which is making appointments. And you mentioned earlier it can be somewhat challenging and difficult. And I particularly think of our seniors out there. And just knowing from my personal experience in my own family, sometimes they are a little challenged with technology and making appointments and even making telephone calls, because sometimes you have to call over and over. Maybe at the state level even, it's and locally as well, what's being done to help with that, make it easier?
Yeah, I think it is a challenge. I'd like to believe you don't have to be old to be technologically challenged, but I'll leave that for my personal view. But I do think this is really an important issue. And so there are a couple of things that are being done. Number one is that we set up working with we as a region set up with United Way to set up 211 so that they have languages and they can connect, and it's not as technologically challenging. We're also working with the Health Collaborative, put together this webpage of testandprotectcincy.com. And though it's not perfect, meaning that you can go there and you can look at all the providers who are providing vaccines and you can click to their website, but you do have to click to each website to get there. There's not a single source. We just technologically just can't, but we did try to bring that information as well. And I do think that all sorts of the agencies, the public health departments, the Council on Aging, these are all organizations that are working in concert to figure out ways in which they can reach out into particularly hard to reach communities. You know, I know that the Cincinnati Health Network, for example, I think it's just now receiving vaccines so that people who are homeless, who are eligible, can start to get the vaccine, which is a particular challenge when you think about the fact that you need 2 doses. And so it's all those things that I think, and maybe the thing I can tell you that maybe not being a native Cincinnatian is I am incredibly impressed on how every part of our community, every agency has come together and sort of said, what can we do to tackle this issue about getting the vaccine to individuals? Because it's not monolithic. It's going to take multiple avenues.
Dr. Lofgren, I just wanted to chime in about that. You know, I feel like, you know, a COVID, I don't know, guinea pig. You know, I had COVID in August. You were with me when I donated plasma. Thank you for coming by. It was totally painless, really easy.
And thank you.
That's great. And then because I do volunteer substitute teaching at St. X High School, they wanted all their unpaid staff, you know, like me, people who are actually in the building with the students and other staff members to get vaccinated. So I was able to get the first vaccine. The next one isn't for several weeks. And that again was painless and, you know, just a great process. But then, so let me talk about my mother-in-law, who's 85 years old. So someone called her and said, I think it was a call from her church, from Carmel, saying that, you know, because you're in this age group, you can get vaccinated. They told her where to go, you know, what day to go, what time. She didn't write the number down, but she did show up at the right time and place. And for some reason, they didn't have her name, but, you know, she had her ID and all that. So they went ahead and vaccinated her, which was great. And then told her when to come back. So when she went back for the second vaccine, they still didn't have her name. And I'm thinking like, you know, and I kept saying, well, who'd you talk to? Who'd you register with? And, you know, she wasn't quite sure. So, you know, those things happen, right? So they, so what we did is we said, let's just call 211 and see what happens. Somebody answered the phone immediately. They took her name, they took her information. And a few days later, we received a call saying her appointment is going to be, and they, you know, they gave the date and the time and the place for her second vaccine. I mean, it was so painless and, you know, so easy. And I just want to, you know, thank United Way 211, you know, whoever is manning that line or, you know, womaning that line, because it just took all the stress out. I mean, it was great. And so, you know, for those who don't want to use computers or maybe don't have a computer, I mean, just call 211. I mean, it was so easy. So I can tell you as someone who actually used that service, it really works.
That's really good information and a wonderful resource that people can try. Dr. Forrester, I have a question for you, sort of picking up from what Councilmember Kearney mentioned. Is there a difference between the rate of infection and between women and men? I mean, do women have a tougher time of it? You know, certain populations, I know with all your scientific study, I just was curious as to whether there was a difference.
I don't believe that we've seen anything like that over, you know, over at least the course of the initial disease. I think that those things are going to be, remember, this has only been around for a year and honestly in the highest rates of infection only several months, really. So I think we're going to learn more and more about that as time goes on. I also think we're going to learn about, I mean, we're going to learn about like who gets the long-term effects, who doesn't. I think there's a lot of differences even within the initial, you know, initial infection, why certain people get very sick. And we see some things like, you know, uncontrolled diabetes, obesity, those things being high in there. But in terms of gender, ethnicity, that kind of thing. I think those are going to play out. It always takes numbers to see statistical differences. So I think we're going to, those are definitely things to watch as time goes on.
I guess it just seems like it's been a decade, but it's only been a year, right? I speak.
Oh my goodness, yeah.
Well, I want to wrap up here. A lot of people are, for lack of a better word, COVID weary, right? And there is some concern that people are just tired of it. Spring's coming. They're hearing about the vaccine. What would any of you or each of you say to tell people to just stay in there? We're almost there. What advice or words of encouragement would you leave?
I can give non-medical advice. Just think about running a race, like running a marathon. I mean, when you get to that last lap or that last, part of it, you're exhausted, you're tired, you're sick of it. You just want to sit down, but something inside of you says, just keep going. You're almost there. And when you hit that finish line, everybody's cheering, and that's where we're going to be. So I just encourage people, keep that mask on, keep social distancing. We are almost at the finish line. We can see it in front of us, but we cannot stop now. We can't stop now because that just pushes us back. We have to keep going and just keep pushing and keep encouraging each other, because the light at the end of the tunnel is visible. We are almost there. So do not give up. Stay the course and encourage everybody around you to stay the course, get your vaccination. And this time next year, we'll, even before that, we'll all be out celebrating. The Cincinnati Herald will have his daddy-daughter dinner dance again because everybody's calling us about that. So, I mean, just so many great things. We'll be in this and we'll be safe. And so I say, stay the course. The finish line is in sight. Don't sit down now. Don't get tired. Don't get weary.
That's great.
Fantastic advice. Yeah.
That gives me encouragement too.
Yeah, I would just echo that. I mean, I think a couple things is that we are in the beginning parting of the end, if you will, and it's really exciting. We're seeing some real impacts on nursing home and elderly people are getting vaccinated. A couple elements though is that we got really to get our life back. We got to get the virus out of our community, and then it's safe to go to these congregate stuff. And so that even if you've been vaccinated, you still need to wear your mask. You still actually may not get infected, but you may still carry the virus and still be somebody who could spread it. So we know it stops the spread, but the more that we do it, the more that we're going to be able to gradually get back to our normal life. And the other thing I would say similarly is that I think when we saw the big uptick in cases in November, December, it was no longer the schools and the bars. It was really people getting tired and popping their bubble. I know you, and you seem like that you're not infected, and all of a sudden you are seeing more individuals, and that statistically ultimately spreads the virus. So your message is spot on. We're almost there, and we just got to hang in and just get rid of this virus. So it's history.
And I am not a marathon runner, but I do get the, I don't run at all actually, but I do get the analogy of, especially in Cincinnati with all the hills and turns that all the marathons have, it's turning that final corner where you can see that finish line. I've been at the finish line waving and cheering, and I'll be there now too. Agree with just continuing everything. And knowing, I think one of the important things, knowing how hard it is on everyone. We all agree we're tired. We have our ups and downs with it. So just when you see someone there in that spot, just be kind, continue to encourage each other. I think that's ever so important right now as we're tired and, lonely. There's people lonely out there. So reach out to people as well.
Well, that's great. That's a great note to end on. And I want to thank each of you. And we are just so fortunate in our community to have UC Health and with all your expertise. And if anybody should be tired, it should be you all, because you've been fighting this and you've been on the front lines, and now you're on the front lines of getting the vaccine to us. So we really thank you. And Councilmember Kearney, thank you so much for taking time out of your very busy day and helping get the word out And you do so much for our community and so much for Uptown. We can't thank you enough.
Thank you. I mean, I'm just so proud of all the work Uptown does. You know, I just love UC Health. I always talk about my love story with UC Health. So, you know, I'm just really thankful for, you know, all of our doctors and nurses and medical workers. I mean, they've just made a huge sacrifice. We don't thank them enough. I don't think we ever can thank them enough. You know, it's a war zone out there, and I know it's exhausting. So thank you so much.
All right. Thank you all. We'll end here and stay tuned for our next show coming up, and you'll hear more information about that later. Thank you.
Thank you, Beth.
Bye-bye.
Thank you.